Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today in the show, we have Amish Desai. He's an internal medicine physician, and his KevinMD article is titled The Reality of Being a Physician and a Son at the Same Time. Amish, welcome to the show.
Kevin, thanks so much for having me. Love your podcast and love the work you do. It's really privileged to be here.
Oh, thank you so much for sharing your story and joining me today. And before we get into that story, just briefly share your own journey to where you are today.
Yeah, my background to sort of where I'm here today, really focused predominantly on vulnerable and underserved communities as a internal medicine physician, and did my training in internal medicine. I got a master's in really thinking about how do we improve the healthcare delivery. So currently in value-based care kind of models of primary care and outpatient medicine physician, helping designing how we really take care of the patients and make sure they don't get left behind. But really that's how I got here. And really the last 6 to 12 months have been really eye-opening for myself, my family, and happy to share the story.
Absolutely. So before we get into the story, so I'm an internal medicine physician myself. So give an example of how you as an internist move the needle when it comes to helping underserved populations.
Yeah. The example I would say is how do we really think about pushing proactive instead of reactive care? And so how do we design healthcare models and systems to really stratify our patients around risk and really then think, how do we keep them out of trouble with really community health workers and care management and wraparound services? Often that in between our visits, there's so much that happens and so much we need to do, thinking about where our patients sort of live, work, and play, the social context of what they do, and then thinking about the whole care continuum, right? When they're in the transitions of care in the hospital setting, how do we make sure we really keep our promise of and be accountable to them? And I think that's probably the arc of where I've been, what I continue to want to do.
All right. So you share your story here, the reality of being a physician and a son at the same time. So tell me how this article came about.
Yeah, Kevin, and I apologize at times if I get a bit emotional, but the story is truly about my father. And about the end of 2020, we knew he had IPF after sort of dry cough and things like that, came to that diagnosis.
And then for those who aren't familiar with IPF, what is that?
Idiopathic pulmonary fibrosis. And really that what that diagnosis ultimately means is a path of continuous, right, remodeling of the lungs, fibrotic changes or changes in the lungs. That really means you need to be on oxygen. You need to sort of a path that way unless there's an alternative option, which is often lung transplant. But that was really interesting during the pandemic, of course, right? Where you're thinking thoughtfully of how to protect your father. And really, around COVID, we did that for him and obviously our loved ones, and making sure we kept him safe as we kept our patients safe, right, around mitigation strategies. And thinking how this article really came about, at the end of February this past year, he went through his first kind of flare. And at the same time, I tore my Achilles. Life was just really altering, I think, for him, someone who has not had a ton of real sort of other significant health problems, someone who's been the backbone of our family, right? Coming to this country and doing all that he could to give me the opportunity. So that kind of sort of centered on this story, and what ultimately then unfolded in the lessons I learned over the last 6 to 12 months, being both a physician, of course, and the backbone of being a son to him.
So tell me some of the feelings and mixed emotions that you had fulfilling those dual roles.
Yeah, there's pragmatism of being a physician, right? How do we continue the pace of all that I can do and really all of our connections like allow us to leverage, from my residency program director to getting connections back to the pulmonary department there to get second opinions, to get him quickly in to see a specialist, whether it's for cardiology, renowned when he was going through transplant eval, leveraging connections and leveraging the pace that I think kept us grounded on his care needs, with the mixed challenges of when things didn't go the way we wanted it to go, whether it meant that through the transplant journey, places that said no, and given age, complexity, how did I still leverage the optimism as a son, right? To say, What else can we do? What else should we be doing? So it was hard, I think, the first mixed feeling, but something that I learned a ton to both leverage my skills as a physician, as a clinician. When he's going through a flare, what else should we be thinking about? How do I signal to his pulmonologist? At the same time, to not give up hope, anchoring on the hope that, and some of that actually, Kevin, has been from his strength and his fortitude, seeing him trying to do 6-minute walk tests to keep like his strength up, checking his sort of pulse ox all the time, to sort of checking on his weight to keep him centered and really strong as well. So, leaning in on his strength and his positivity has been really critical to my own optimism when we were going through really tough stretches.
So a lot of times as physicians, we don't often navigate the healthcare system from the patient perspective, right? So tell us, what are some surprising things that you learned as you navigated the system from the patient's perspective?
Yeah, it's so often not timely, right? Number one. And whether that would mean when we call a colleague or a specialist, or we call sort of a larger institutional body for an imaging test or for a study or for lab draws, it's often not timely, right? And it's not time sensitive or time bound depending on sort of needs. Even when on our end, right, even though we put in maybe an order or we put in sort of the intentionality, the system often doesn't allow for it, right? I think too, the other challenge that I found for him is the sort of the confusing nature of his insurance that allowed him to have authorization under transplant for a ton of things, but then out of network for a specialist that wasn't under the transplant umbrella, and we would have to be debating between sort of his main hospital system and another local hospital system. So I think really the confusion for him, and I think the swiftness that we needed that often wasn't allowed unless I jumped in, right? To say, hey, I need this because I know from a time sensitive nature, and given the connection, I could sort of work around.
And how would you do that when you jumped in?
I would
Phone
just jump in.
call?
Yeah, phone call and text, right? So I think often saying, either if I was on staff already at the main hospital system, or I had connections through a fellow colleague, an email would just go such a long way, right? Or a text would go such a long way that they knew that they were talking to another physician on the other side. And the same way when I'm consulting for my own patients for specialists, right? The level of engagement that automatically happens because there's another physician on the side. And I think it's sort of that advocacy that I think is also lacked, right, in the patient journey, that naturally comes when there's another physician on the line, right? That they're advocating because they know that there's someone else that has expertise, or that feels like there's a reliance on what is being asked. And I think, so Kevin, I think to your earlier question, I think the timeliness and the lack thereof, the advocacy or the lack thereof, and the confusion that just sort of naturally comes in navigating the system.
So I want to circle back to something you said, that you had to balance the severity of your father's condition with hope.
Yeah.
How did you go about doing that?
Yeah. This is one that I've thought a lot about, both what this means for me individually, and then I think as I think about sort of lessons for us as a physician and clinician community. Personally, I leaned in others to support the optimism, support the hope. My sister, my mom, my wife, and most importantly, my father, right? I think, as sort of I highlighted. I also think there's like cultural nuances to this, right? As you navigate optimism and hope, that is really beautiful and can get people motivated around what they need to do to really keep up their appointments or next steps, right? And so often I then think of, well, how do you navigate that and do that thoughtfully then in the exam room, right? How critical that is of bringing in pragmatism around the severity of an illness, but the motivation around whatever the next step, even if that next step, more discussions around goals of care, right? And getting to that means balancing the positivity and the optimism that's needed. So I would say that it has been really challenging, at the same time eye-opening around how to do it thoughtfully in every moment. To be honest, now at this point too, Kevin, as we're navigating now, where we are with transplant and really the other path of just living with IPF and what that will mean.
So tell me how this experience, after you've mentioned experiencing this whole system as a patient, how does that affect you going forward as you now see patients as a physician? How has this experience changed you as a physician?
Yeah, I think one first is really around how do you take the pause that is so hard to do when there's life-altering things, and it doesn't have to be this example, but anything. And we're so deeply engaged, rightfully so, that we often forget about our own well-being and forget our own challenges, and we put them to the side, and either they keep piling up and lead to either burnout or challenges in wellness. But I think the first thing is, how do you take the thoughtful pause that you often can't get, but really know you need? And so that was, I think, one. But two, the piece around the exam room and what this means for patients. One, I think it's a lot harder than we say it is around caregiving. So often take care of seniors, and when we have those conversations around complex caregiving and the family dynamics and the needs, like there is so much depth to what happens outside of that clinical encounter. Yeah. And we need the other people, right? The social worker, the case manager, or the palliative care team to really deeply dissect how families navigate, right, caregiving. So I think that's one lesson. I think two, I think the cultural nuances that come with end of life and navigating goals of care that I think are really important, that I knew about. And then when you face it yourself, you know it to a depth.
So talk a little bit more detail in terms of what would be an example of how your culture, how did that influence the situation?
Yeah, I think two things. One, how do you think about, often I think in sort of a lot of traditions, whether it's South Asian or others, that anchor on shared well-being and anchor on sort of community. How do you think of caregiving and the services that are often offered in home health and whatnot, and how do you intersect leaning in on community and sort of social connections versus sort of institutional things that we just naturally go to? So it's like one of like really understanding family and community dynamics when you think about home needs. And then two is around discussions around the pragmatism of what we need to say and the navigating hope, and where in reality, how we talk about it and still talk about it both allows us for next steps to happen, but doesn't lose the family hope or the potential other side of getting through this, right? And often we can be harsh in the exam room, right? And we don't mean to. And so how do we do that in really ways of understanding cultural nuances by asking, well, what do you know about this? And how do you navigate that with your own cultural understanding or religious understanding or spiritual understanding? My dad would often say, and still says, he's been given a number of breaths and by a divine power, and that's written, and he believes that, and that allows him to sit up every morning and still do kind of yoga and pranayama and believe that is what he can control and then what he can't control, right, in sort of the process. So
we're talking to Amish Desai. He's an internal medicine physician, and his KevinMD article is titled "The Reality of Being a Physician and a Son at the Same Time." Amish, what are some of your take-home messages that you want to leave with the KevinMD audience?
The first biggest one, which I think kudos to you and this work, is just how important reflection, when things become hard, right, is. It gives a moment of respite, right? Like for myself, my sister's a writer, she writes. So actually reflection is so important for two reasons. It gives you respite and like a mental reprieve, right? To an outlet. And then allows you to then move in ways when you sit down and break down what you've learned, it allows you to sort of self-analyze what maybe you could do differently, right? And move differently. And so I encourage people to really reflect, write, speak to others about things that they have learned, because it will influence, most importantly, yourself in that journey, but a ton of other people, right? And I've gotten lots of text messages and through social media and posting of how just writing this has made others also think about their own situations. So I think that's really important, number one. I think lastly, for our physician community, is how do you take a pause in whatever way you can when there is life-altering things, to think about your own wellness and well-being, but also then think about shared well-being, right? Whether that's your partner, your spouse, your whoever you consider your loved ones. Think about individual well-being, but more importantly, shared well-being. And I think Tim Urban's quote on countless time and countable time, really important when you sort of take into the context of our lives. And really, we have countable time with people that we spend with, and how do you make decisions that you don't have regret about? And those are probably the biggest lessons that I'd like to give to the audience.
Amish, thank you so much for sharing your story, time, and insight. Thanks again for being on the show.
Thank you, Kevin.